The numbers first. Since Monday, Kansas has reported 1,488 new positive COVID-19 cases and 25 new deaths. This brings us to a total of 74,456 cases, 3,506 hospitalizations, and 952 deaths. Kansas continues to see as many as 700 new confirmed cases of COVID-19 every day, still the largest increases since the pandemic began. This consistent high case rate has begun to affect our hospitals. Some, including Pittsburgh's Ascension Via Christi Hospital, have halted all non-emergency procedures to ensure staff can care for the influx of coronavirus patients. Over a 2-week period, Norton County, located in our state's northwest quadrant, had the largest percent increase in COVID-19 cases in the nation, proportionate to its population. Several other northwest Kansas counties were not far behind. As you know, at the Anby home in Norton, all 62 residents tested positive for the virus, and tragically, 10 residents have died from the COVID-19 related complications. I offer my deepest condolences to the family and loved ones of those residents who succumbed to the virus, the hardworking facility staff, and the entire Norton community. After we learned of this outbreak on Friday, I directed the Kansas Division of Emergency Management, or KDEM, to provide the county resources to mitigate further spread. Since then, the state has provided Norton County with personal protective equipment, test kits, ventilators, powered air purifying respirators with cartridges, and several doses of remdesivir. Additionally, the Kansas Department of Health and Environment is in regular communication with the Norton County Health Department and Norton County Hospital to provide guidance and coordinate virus response. I'll continue to direct our agencies to leverage the resources necessary to assist the nursing home and the county going forward. The tragic deaths in Norton are a stark reminder that COVID-19 poses a real threat to all Kansans, and it doesn't stop at county lines. Yes, cases in communities like Norton are higher because of outbreaks in jails and nursing homes, but there is also wider community spread. Outbreaks are not isolated incidents. For months, many have mistakenly shared the idea that this virus would never reach our rural and lower population communities. Now it is worse in those towns and counties than it is in our cities. Currently, 2/3 of the state's COVID-19 cases lie outside the Wichita and Kansas City regions. Harmful anti-mask and anti-science rhetoric has politicized our ability to tackle a public health issue, much of it coming from our elected leaders. Here's the truth. The public health experts and scientists have done their homework, and they're all saying the same thing. It doesn't matter if you're in Norton County or in Johnson County. We can stop this virus if we wear masks, follow good hygiene practices, socially distance, and avoid mass gatherings. I know there are Kansans listening right now who are still unsure what to believe, so let me share a few things with you. This week, the public radio station, KCUR, released a story regarding in-person learning, explaining that the schools requiring masks, maintaining social distancing in classrooms, and regularly sanitizing have lowered the rate of COVID-19 spread to almost zero. Using data from nearly 2,000 students in 47 states, a study conducted by Brown University economist Emily Oster and her team found a case rate of 0.13% in schools. The case rate for staff was 0.24%. If that's not enough for you, here's another local example for you. Hair salons and barbershops have been open now for months. seeing customers in close contact every day. This industry has always embraced good hygiene and sanitation, and we're quick to add masks to the equation. In the entire state of Kansas, there has not been a single outbreak associated with one of these personal service industry establishments. More evidence that masks work. One more example. During one of my COVID briefings in July, I pointed to Texas as an example of what happens when states do not take the virus's threat seriously. At that time, the governor in Texas had resisted repeated calls for a statewide mask order, saying that Texas did not need a one-size-fits-all policy. Cases in the state continued to skyrocket, and deaths rose at an alarming rate. In response, the governor, a Republican, established a statewide mask order in July for counties with 20 or more positive COVID-19 cases. In the weeks following, positive cases in Texas dropped dramatically, and they continue to fall. Wearing a mask should not be political. It's about public health and keeping our economy and our schools open. We cannot sit by as the cases continue to rise in our rural communities, threatening lives and businesses. We're considering all the avenues my administration can take to require masks in public places statewide. I plan to hold a discussion with House and Senate leadership to work towards a bipartisan mask requirement. I know there are political challenges for legislative leadership, and that there are some Kansans who won't be happy that I'm trying to do this again. I also know that this issue is bigger than just Kansas, and national politics have made it harder to reach bipartisan consensus, even on issues that have nothing to do with politics. But I personally believe that it's a terrible thing that Speaker Pelosi and President Trump are unable to speak to one another. But I'd be abdicating my duty as governor if I were to fail to confront this problem just because we're close to an election. I'll leave you with this. When I issued the mask mandate executive order on July 3rd, more than 90 counties chose to opt out. In less than 4 months, the number of cases have gone from 14,000 to more than 75,000, and the number of deaths from 200 to over 900. So I'm again appealing to every Kansan to join me in protecting our families, our neighbors, and our economy. Before I take questions, I want to reiterate that our new unified COVID-19 testing strategy will also play a significant role in controlling the spread of the virus in Kansas. I'll share more of the details of that strategy next week. It is about ready to go to print. Finally, I want to announce a new opportunity for Kansans who, due to COVID-19 related loss of income and need support to make monthly mortgage or rent payments. With Federal CARES Act funds made available through the Kansas Eviction Prevention Program, those in our state experiencing fiscal hardship because of the pandemic are now eligible to receive up to $5,000 in rental assistance. Keeping Kansans in their homes and businesses has been a top priority of mine since the pandemic began. I issued an executive order in March temporarily prohibiting evictions or foreclosures for those experiencing pandemic-related financial strain. I reissued the order in August. When I reissued the order, I said that my administration was committed to supporting these Kansans until the U.S. Senate expands unemployment assistance nationwide. It's unfortunate that now, nearly 2 months later, the Senate has still failed to respond with the necessary resources for those who have lost their jobs through no fault of their own. That's why my Spark Task Force recommended allocating $35 million in CARES Act funds to the Kansas Eviction Prevention Program. Approved applicants can receive a maximum of 9 months of assistance, not to exceed $5,000 per household. Landlords and tenants can apply online at kshousingcorp.org. That's kshousingcorp.org. I encourage eligible families and businesses to apply as soon as possible. Funds are limited, and applications will be processed in the order received until all funds are distributed. Again, Kansans can apply online at kshousingcorp.org. And with that, I will take questions.
Governor, you gave some interesting statistics regarding the last handful of months about masks, or not, counties that did masks or didn't do masks, and you compared the case totals and the death count. Do you have that divided by the 90 counties that said no to masks and the 15 that said yes? That fluctuation of the number.
I don't know that we have compiled, I mean, I'm sure the numbers are there, whether we have compiled them as we did, you know, a month and a half, 2 months ago. I don't know, but I can check on that, and we can make sure that we do that.
But you're not preparing any mask mandate.
I'm sorry.
You're not doing a mask mandate.
I'm going to have conversations with House and Senate leadership to determine a way that we can go forward and get masks worn all across the state of Kansas.
Is there a time frame for those discussions? Are we talking before the election? Are we talking this week?
I don't think the meetings have been set up, but my staff will be reaching out to the leadership in both the House and the Senate, and we will get those meetings set up ASAP.
And given their opposition in the past, I mean, what can you reasonably hope to achieve? You say your administration will look to do whatever you can. I mean, are you looking reasonably for something like Texas, where it's above a certain 20-year mask mandate? I mean, reasonably, what sort of compromise?
I think that would be part of my discussions with the leadership. You know, is let's work together to create a mandate, and then what parameters will surround that mandate. That would be part of the conversation. I don't want to go in with any preconceived notions. No, right here.
Governor, what's the status of the tests that were supposed to be sent from DC, and how are they deploying them, and when will we have enough to test the rest of the population?
Are you talking about the 870,000 tests? Yeah, well, I think we got the initial shipment of about 55,000, and then the other ones are supposed to arrive sort of on a weekly basis. We have gotten the ones I told you about. They've been deployed, but we're adding to that in our own way in trying to beef up the testing that's going on. Clearly, with the outbreaks that we're seeing right now, we have got to do that. You know, one of the problems with some of the tests that were sent to us is whether or not they were accompanied by the kits that you need to actually operate them. So we're trying to put all of that together now. And that will also, quite honestly, be part of our unified testing strategy. So you'll see that all next week, how that gets incorporated into everything else that we're doing, working with the public and private sector.
Will your $35 million eviction
Prevention.
Does that, you have to run that through the Finance Council?
No, they already approved. The way the State Finance Council has worked is that they approved these pots of money, and then they're often grant programs, and so then the agency, the Kansas Housing Corporation, will review the applications as they come in and disperse the money. And I might say, just so everybody understands, that the landlord and the tenant need to apply together, all right, so that they you know, one of them can fill it out and the other one can sign off on it, but they need to do it together. Those need to come in so that we ensure that the money actually goes to offset rent.
This is only tenants, it's not mortgages as well?
I believe I said mortgages, but
So the bankers and the mortgage
that's
people have to apply together too?
You know, I don't have the answer to that. I do need to get that. We need to make sure you all know, even before you write up your stories, whether that...
Another question here. I'm curious, getting back on this, trying to work out a deal with the legislative leadership on wearing masks. Do you actually think it would be best to wait until after the election, because all the political shouting will be over by then, all these decisions will be made, and so perhaps you could sit down with these people and make a deal after the election? Or is it just a necessity to push hard right now to get some sort of order?
I just told you, that as of Monday, we had 952 deaths in the state of Kansas. You know, people don't have time for us to wait around to let an election be over with. You know, we need to start these conversations. We need to come to resolution as soon as we possibly can, and not let, as has happened over the past 7 or 8 months, not let politics play a part in this. But let's just finally do the right thing for the people of the state of Kansas.
So you're essentially saying that the modifications that the legislature made last year in your executive authority is responsible for a large number of these deaths?
What I'm saying is that we know we have a problem, and we need to find a solution. And that's why I'm going to be meeting with them.
You had a solution until they made it optional by county.
You know, Martin, I think when everything happened back in April, May, June, we had a lot less information that we did, so it was harder to make that argument. You know, now it is not hard to make that argument. First of all, we know how many people have died here in the state of Kansas, and we also have, for instance, that study from the Boston Economist that you know, we know that masks work. And we have lots of other data points to prove that. So I think what we know now really has to change not only the conversation, but the outcome.
Thank you. The testing question, has what's going on in western Kansas, northwest Kansas, Warren County, has that changed the distribution of those tests? And does it change at all the allocation of the unified testing strategy, where resources are going to fall?
Any data like that will influence, you know, how the testing strategy is implemented. So yeah, we will be plugging all of that kind of information in. And, you know, I can tell you now that, you know, we've already responded with, you know, testing on site. You know, we worked with the county hospital out there and the local public health officials to make sure. So yeah, those kinds of things will clearly influence where we deploy the testing equipment and kits.